Welcome back to Everyday Kentucky. The Colon Cancer Prevention Project is happy to announce that Kentucky is first in the nation to offer screenings for colorectal cancer in pharmacies.
That's a huge deal.
Indeed.
So we are joined this morning by Emily Wilkerson to tell us why pharmacies are an integral part of healthcare for prevention. So Emily, tell us a little bit about why it's so important that most of Kentucky is accessible to something like this.
Yeah, absolutely. So pharmacies and pharmacists are one of the most accessible healthcare providers. There is nearly a pharmacy on every corner, and patients see their pharmacists way more frequently, typically, than their primary care provider, getting their monthly refills and things like that. So pharmacists are equipped with the knowledge to be able to help with preventative screenings like this, and to educate patients on when they may need screened and what screenings may be right for them.
All right, now what kind of screening and situation will we find at a pharmacy setup?
Yeah, so you'll sit down with a pharmacist. They will determine your eligibility for screening. Pharmacists can specifically offer stool-based screenings in the pharmacy, and they are take home, so the patient is able to take the test home and screen from the comfort of their home, and then the pharmacist will follow up with them on the results. Should the pharmacist and patient determine that colonoscopy may be the best route for that patient, the pharmacist then has the tools to refer that patient either to their primary care provider or the authorizing provider that the pharmacist is acting under this protocol with. So the pharmacist is able to refer patients to that type of care.
Do you have to have insurance for this process?
Not necessarily. Things are billed through the patient's health insurance, medical insurance, but the pharmacist is also equipped with tools to get the patients free screenings should they not have insurance.
I mean, we've been seeing so much happen at pharmacies here these past few years. I mean, you can get a lot of stuff now, right?
Yeah, absolutely. Test to treat flu, strep, UTIs. Not all pharmacies are offering these, but it is becoming increasingly more common. Same with the colon cancer screenings.
And so you really only have to get tested for colon cancer once, is that correct? Or should you get it more frequently?
You should get it. It does depend on the patient. So you begin screening at age 45 if you are at average risk. If you are at higher risk, say from family history or things like that, you may need to start screening earlier, and that's a conversation that you can have with your healthcare provider. And then based on the type of screening you get will be how frequently it is recommended. So for a FIT stool-based test, you're recommended to get those once every year. For a Cologuard or the DNA FIT test, that is recommended every 3 years. And in general, if you are getting a colonoscopy, those are recommended every 10 years if no findings are found.
Right. And
yeah.
So are we talking about this being widespread among pharmacies across Kentucky? Is that what's happening?
Not quite widespread yet. There are about 15 pharmacies that I'm aware of that are offering them, and we have those on coloncancerpreventionproject.org. You can search that website, and they have an interactive map where you can find the closest participating pharmacy near you. All pharmacies are able to offer this service as long as they take a few steps to implementing this. The Kentucky Board of Pharmacy authorizes a protocol. So even if your pharmacy may not be offering it currently, I would still encourage patients to start to talk to their pharmacists about this. And then if any pharmacists or pharmacies out there are interested in implementing the protocol, they can reach out to the Kentucky Pharmacists Association and we can help them.
Perfect. Thank you so much for being here and educating us on how so many different ways that we could take colon cancer testing. So thank you so much for that.
Yes, thank you all for having me.
Absolutely.